Governor, I'm asking about the $5 million. Estimates say that $20 million would cover just between months of April and June. Montana, which has a similar population, put $50 million in CARES Act dollars. And the Princeton eviction lab out of Princeton University rates Rhode Island's response at near zero, whereas Massachusetts and Connecticut both have 4 stars.
Yeah.
Are we doing enough?
Well, let me say a few things. The numbers we have are not as high as what you just said, 20 million. They're certainly higher than 5 or 6.5. And as I said, this is an immediate next step. I think the right long-term step is a broader program where we can come up to a mediated solution. And so that's what we're going to do. And we're going to work with the United Way. We're going to work with the courts. I'm very open to using more of the COVID relief funds to address the issue. But I don't think the right thing right now is to just put a lot of money into it. Because what I worry about is you do that and it gets people to, the end of June, and then what? So I hear you. It is an issue. I'm committed to it. This is a 1-month solution, and we're going to come up with a longer-term solution.
Mediated solutions. Right now in the district court, there's no right to a lawyer for tenants
yeah.
who come in. So would we be looking at that?
Yes. So to be successful, it would have to have a few components. It would have to have a lawyer for tenants. The judiciary would have to be at the table. And we would have to have some uniformity around how we dealt with all of this.
At the court work groups, there were no tenants or landlords represented. The work group was entirely judges and lawyers who work evictions. I have all their names. I looked them up. So there were no groups involved in the court decisions as to how the reopening should be received.
Yeah. I can tell, we're in touch with the United Way, with advocates, with Crossroads. If you have folks that want to be at the table, then let us know. I have no interest to cut anybody out.
Sure. And one last question about homelessness. We know the hotels for homeless people run out on Sunday. Will there be any kind of renewal on that?
Yeah. Yes, the answer is yes.
Yes, the program that we've had in place for temporary housing for Rhode Islanders experiencing homelessness as a strategy, there's 2 different pieces to the puzzle, and I don't want to confuse the 2. The quarantining and isolating of housing insecure Rhode Islanders that's been taking place at the Wyndham, that is an open-ended commitment, and that was not scheduled to end. There was additional facilities, hotel facilities made available to help de-densify the shelters, and that was previously scheduled to wrap up on May 31st. We have extended that for 30 days to June 30th, and the advocates have worked together on a transition plan. Unfortunately, we know that helping de-densify the shelters through hotels is not a long-term solution. It is not a sustainable solution. And so we've worked hard with the advocates to come up with a plan that they need to execute over the next 30 days. We've given them that extension so that they have a little bit more runway and so that we can make sure that not everyone who's currently housed in a hotel goes back into the shelter, but that program has been extended for just 1 last month.
Thank you.
Governor, what changed on youth sports? I know the CDC updated its guidance, but what changed? Was it just a lot of feedback from these organizations? And if so, explain the process on that, and if people push back hard enough, are you willing to change something? And also, does this apply to adult recreational sports leagues as well?
Such a good question. I'm saying that because it came up yesterday. No, it doesn't mean that. So it means I do listen. And when I hear from people, we don't want to do this, that's not compelling. But when I hear from people, we have plans, and this is what they look like, and we can keep everybody safe, and we promise we're going to follow the rules, well, then that is compelling. Because, I want kids to have sports. I want kids to have camp. I want kids to go to school. I want everybody to go back to work. That's the goal. The worry is that if we allow that and people don't follow the rules, then we're going to be in a bad place. So some of it was the CDC guidelines and kind of encouraging us to enable youth sports. Some of it was talking to a lot of people, a lot of coaches, athletic directors, parents who show us their plans and say, listen, trust us, we promise we'll keep these kids safe, we'll wear masks, won't share balls, we'll keep stable groups of 15. And so I'm saying, fine, if you can follow the rules, you can go ahead and do it. And yes is the answer to the adults.
Dr. McDonald, first of all, good afternoon. One of the most consistent things that I've heard from various communities around the state over the last month or so is the need to have open testing, to waive the physician's referral. Is the reason that we don't have that right now some kind of rationing situation with tests, or why don't we have open testing? In other words, for those who are out there listening, where you don't need to go see a doctor to be essentially approved to go take a test. Anybody could just show up at CVS. What's the explanation for why that's not taking place?
Yeah, so keep in mind where we are in the pandemic is just day 89, and where we started isn't where we're going to finish. So I think open testing is coming soon. Keep in mind there's a strategy we have for testing: symptomatic, outbreak, screening. That's our strategy. And part of that is just managing a resource is where we are with testing. You know, having said that, I think the day will come, though, where if people do want to be screened, they can do that. What we're doing as a state is trying to do this in a manner where there's a strategic approach to it so we can answer legitimate public health questions. And there still are a fair amount of questions when it comes to testing. And I do want to just put a little point out there, too, is that screening testing isn't the same as diagnostic testing in some ways, but it's the same test you get as a person. So when you're having that nasal swab test done, it's the same test. But a symptomatic person means someone's sick, has got some symptoms. A screening person might be someone who's well. I was tested a few weeks. I was fine. But because there was a concern at the Department of Health, I was screened. And I think that gets to that issue of what's the difference between screening and symptomatic. And so I think that that time will come, but right now we're working through the strategy we have. So, thank you.
Governor, you called the data today, quote, a good news picture. There's a clear divergence, it seems like, between the stable declining data on cases and hospitalizations and the deaths. The 7-day average for the reported deaths is back near the peak. Like, what's going on? Have you looked into why? Is it just because the nursing homes it's out of control, and even though the rest of the population's okay?
And then I went Dr. McDonald. To be clear, I did say that the deaths were deeply unfortunate. So, except the good news, I want people to know. My main point in saying that was, we've loosened up on the economy, and a lot of people are saying, "Are you sure it's safe?" And my answer is, yes, because now we're 14 days of the observation, and so if we were going to be seeing a problem with the spikes, it would be now. The deaths, look, it is concerning. Good news, bad news, in the context of all of this bad news. Our deaths per capita are still lower than Massachusetts and Connecticut and many other states, but it is the nursing home issue. It is exactly what you say. The vast majority of our deaths are concentrated in nursing homes. I think he went over the data, and again, that's who we continue to see that we're losing. And we...
As soon as it gets into one,
it's really hard
you're just
to
finding
control.
it uncontrollable?
Infection control in these environments is incredibly difficult. You have some nursing homes where there's one bathroom for numerous people. They don't even have private bathrooms. You have... It's a population that is older and frail and sicker. This virus is brutal on people with underlying health conditions and on people that are older and frail. A lot of times you have staff who work in more than one home. I mean, there's no one thing. It's like a perfect storm of, it's just really hard to control it. I don't know if he's the doctor, so he can talk about the details of the virus. I can just tell you operationally, having the right level of staffing, the right level of infection control, consistently applied to a very high-risk population living in close contact with one another, it's a hard puzzle.
Did you expect it to still be this high at this point?
I don't know what I expected. I don't know if I had expectations. I don't think it's that different than anywhere else. You know, what I constantly say, what could I learn? What could we be doing better? I can't find anyone else who's doing a much better job in terms of any other state. So we're trying everything we know how to do with nursing homes. We've done, I think, 52 missions into nursing homes where we send in our support team to help them, and they keep calling us. We have found hundreds of volunteers to help fill staff shortages. We've done the wage bonuses to help people keep working. We're doing, the National Guard is helping hugely. We're providing lots of PPE. Like everything, we're cohorting. We have COVID-19 nursing homes. All the best practices you're supposed to do, we are doing. And again, I look at our veterans home experience versus other people's veterans home experiences. Every death is a problem, but our experience is so much better. So it's a challenge, and I wish I had a better solution. At the moment, we are doing as well as anywhere, and we're doing everything we can figure out how to do.
Governor, sorry, that Florida, a lot of people point to Florida as doing a lot better on nursing homes because they took different steps earlier on. I don't know, Dr. McDonald?
I cannot speak to that. I'd be surprised. I'll look into it, and I'll get back to you.
Well, I guess, Dr. McDonald, I understand, we've talked about deaths as a lagging indicator. We've talked about, clearly there's a huge divergence at this point between the general population and the nursing home population experience with COVID in Rhode Island. Are these lingering from earlier times where you guys didn't have as much of a handle on it in nursing homes? Is it still just sneaking in under the door in nursing homes and, wiping through the populations? I mean, what are you seeing right now with it?
Well, so let me get your answer out with just a first understanding of why people die from COVID-19. Remember, it's the SARS-CoV-2 virus, and it's an acronym. I think sometimes when we talk about acronyms, we forget sometimes what the acronym stands for. So it's severe acute respiratory syndrome. So I want to underscore it's a syndrome, right? So in other words, it's very, very different from influenza. It's a disease which causes a great deal of inflammation throughout your entire body. Now, what we're trying to understand is, and this is still a global question, is why are some people more susceptible to this inflammation than others? Many of the people who have serious adverse outcomes, like being in the hospital or passing away from the SARS-CoV-2 virus, have end organ damage, kidney failure, have strokes, have problems with their heart. All kinds of problems come from this inflammation. To get to your question directly, though, it is a lagging indicator for a couple of reasons. One is people take time to go through this, and some of those people get saved, thankfully, and that's what's great about ICUs and ventilators and hospitals. We can save those people. They stay a long time. But as we get death data reported, it doesn't come in like someone doesn't pass away on a Monday and we get the information Monday night. It takes days for us sometimes to get this data from multiple data sources, so that's part of the delay that we get there. And I think just keeping in the back of our mind is it's tragic when anyone passes away from this disease. It just is. One of the things that I'm really looking forward to someday is a treatment for this. I can't tell you how hard it is to have a disease that we have no vaccine for and no real treatment for it. Now, the remdesivir is an option. It's an antiviral. What I'm excited more about with treatment, quite frankly, is the anti-inflammatory work that's going on as well. So I see science moving in multiple directions toward treatment because we may not be able to kill the virus, but if we can mitigate what the virus does to people, in other words, stop that cascade of inflammation that destroys someone, then we have something as a planet we can hold on to. And so that's, to me, an exciting area of research.
But I don't think so. I mean, he's the physician and the scientist. But we just haven't figured it out. It's not that it's lagging and we're on a much better trajectory. I don't want to say that. It's like the nature of the virus is such that it's, like I said, it's really brutal on the population who lives in a nursing home. When you live in a congregate care setting, and Rhode Island, as far as states go, we are overly dependent on nursing homes. The number of our the percent of our system that's in a nursing home versus, say, home care is very high. It's high. It's higher than, I think, any other state in America, or certainly higher than our neighbors. And there are inherent dangers to these kind of communal living environments, especially when you're talking about a highly infectious disease. So I think for us, I'm not saying we won't do more. I will look at Florida. Maybe we can learn something. If we can, we'll do it. I just know what we're doing, and I know what other people are doing, and we have a robust response. The truth of it is, I think what we need to start asking ourselves is, long-term, is it the healthiest way to take care of our elderly loved ones to put them in congregate care settings? Or is it time to get serious about investing more in home care supports so that, God forbid, next time this comes around, we're not as vulnerable? And every day when you talk to the experts in Washington, they're on us by saying infection control needs to get better in nursing homes. And they're right, but there are some inherent limits when you have dozens of people who are sick, close together, sharing bathrooms, sharing rooms. It's not an excuse, it's just a reality. And so I think there's short-term things we can do, and I'm thinking about long-term, rebalancing.
Governor, how much of the $1.25 billion has the state spent today? And what is the rough accounting? Not in point, but just a rough accounting.
That I'm going to have to turn over to Smiley for the details, and then I'll tell you my vision for how we're going to spend it.
So we've been reporting monthly to the general public, to the legislature. There's a transparency portal that'll be live next week. And the last time that report was ran, we had either spent or encumbered, which means like committed to spend, approximately $150 million of the Corona Relief Fund. We presented to the Senate Finance Committee last week some preliminary budgets for the rest of the calendar year. For many of the governors stood up here many times talking about how we're organized around work streams for the testing group, the PPE group, et cetera. And the projected budgets for those work streams for the immediate health response, which is the intent of the funding and the first and most important thing to do with that funding, the range of budgets, some of these are hard to predict how many tests we're going to need at a certain time and what the unit cost of PPE might be in November, as an example, but the range for those budgets are in the $600 to $900 million range out of the 1.25.
He's right. And next week we'll have the transparency portal up. The money is intended to be used. The exact words are what the governor deems necessary to meet the immediate needs of the crisis. We will spend hundreds of millions of dollars on testing. We will spend, tens of millions of dollars on contact tracing, quarantining, isolation, food delivery, et cetera. So the vast bulk of it will be to meet these immediate needs. And I need to make sure we budget it over 12 months. Best guess is we won't have a vaccine until, call it a year from now. So I'm budgeting and saying, okay, we have to make sure we can maintain all of this for until, say, next June 1st.
So right now you've spent approximately 10%, and you're looking $150 million out of the 1.25, maybe a little bit more.
Spent, but we have a line of sight to we have probably allocated $500 million.
Testing commitment.
Yeah, commitments. So we'll, like right now, and again, if it's hard for me to do this from memory, but over the course of the year, we'll spend $250 million on testing alone. Year to date, we've spent a fraction of that.
Right, so are you holding some back, hoping, so there's been this big discussion in Washington about helping the states balance their budgets, and so $1.25 billion is a good chunk of money for Rhode Island. And so there are some businesses right now facing cash flow issues that could use, I mean, you could allocate $100 million right now, and for those that are looking at 50% allocate capacity on restaurants or whatever, to get that money out the door now. There's some people I've had who've contacted me and said, hey, the governor's holding that money back because we're facing huge red egg.
Correct.
What about getting that money out the door now and worrying about your testing money at the end of the year? You got businesses that aren't going to make it to the end of the year if you don't get money out the door now, some of that money.
Well, I don't think that's the right way to, so look, you make a good point, but here's the thing. We do have an $800 million deficit. As I stand here today, I am hopeful that the federal government is going to do the right thing and send states another stimulus. I cannot guarantee that. One of the options they're considering is to give us flexibility with the $1.25 billion to solve some of the budget hole. So I'm trying to, it's a delicate balance. I mean,
Some of that back because that's in the back of your mind.
Yes.
It's like the Google money.
Absolutely.
North Providence State Police, East Providence, they had this huge pile of money
Yeah.
years ago. They could only spend it for a specific thing. Well, then they got creative, and they said, well, as long as you have the money, you can use it. So if you're not expecting more money to come in, there's some people who want that money right now dedicated to businesses.
I
but
hear
you seem
that.
to have different streams in your mind.
Well, I just need a little more clarity from the Congress, and I am told that we're going to have a lot more clarity at the end of June. If I knew today, Speaker Pelosi's bill, which passed the House, would send to Rhode Island another $1 billion to help us solve our budget deficit. If I got that, I'd spend the $1.25 billion tomorrow, because I would like to help all these restaurants, absolutely. Now, somehow, I don't think her bill is going to pass the Senate. So in light of this uncertainty, I'm going to continue to meet the needs of the emergency, rental assistance, we're going to have to do something for businesses, we have to keep doing the testing. But if at the end of June, Congress says, sorry, you're on your own, but you can use some of your $1.25 billion to fill your budget hole, I think everyone's going to be happy that I held some back. If at the end of June they say, here's another half $500 million, then absolutely, I would absolutely like to do that. And it's a tough call. Lots of other governors are spending in the way that you said. They're taking a gamble. And I'm just not ready to do that right now.
Governor, I just want to follow up on that. Yesterday, Lieutenant Governor McKee gave an interview where he apparently criticized your administration not acting quick enough. And his quote is, he encouraged small business owners to target the governor's office with phone calls. The governor's office should receive a deluge of phone calls, release those federal dollars. Is that a fair criticism from Lieutenant Governor McKee that the state did not act more aggressive?
I don't think it's fair. He's welcome to call me. He doesn't have to have other people call me. No, I mean, I just went through that. I don't think it is a fair criticism. But I hear them. They're struggling. PPP is out there. Lots of businesses have taken it up. It's not enough. At 50% capacity, can they break even? We don't know. It is my intention. Let me say this. It's absolutely my intention to get more money into this economy, to help small businesses, to help people who need to be retrained. I'm just waiting a bit more, and I'm talking weeks, not months, to see what Congress is going to do. And look, if I can't do that, if a week from now or 2 weeks from now it looks like Congress is going to pass a good bill and we have lots of people going out of business, then I'll move more quickly. But that's how I'm thinking about it right now.
But a small business owner listening right now, they don't need to call your office and say, release that money.
I mean, they're welcome to. I'd like to hear from everybody. We have like 3 or 4 Facebook town halls every week. We're talking to businesses. I hear from them constantly. And a lot of them call and we help them one-on-one. People call all the time. We help everyone in a way that we can. And there's a lot of commerce programs that are available. But like, to put political pressure on me, I don't think is helpful. Because the truth is, the only way to close an $800 million deficit is a lot of layoffs. Teachers, firefighters, state employees. It's massive restructuring. And those are decisions that I hope to never have to make. So it's a balancing act right now, and the next few weeks are tricky. But I do want them to hear this. We won't let them to hang out to dry. We will find some way to get more money out there to give relief to the business community. And the thing that I'm very, very, very worried about is kind of what Jim was just saying. Like, there's a lot of industries, like retail, that are going to get hit especially hard. And if you're a person who spent your career in retail as a clerk, and it's the only skill you have, man, we got to help you out. We got to help you get some skills so you can get another job. So to answer your question, Hummel, I'm waiting a couple of weeks to get some clarity on the feds, but I'm also going to be there for these businesses.
Last question from Tom.
Governor, coinciding with your Phase 2 opening next Monday, it looks like the Massachusetts tribe down in Connecticut is going to open up Foxwoods. Yesterday, 3 of Governor Lamont's officials toured the casino. It didn't seem like they were restricting the tribe from opening. Have you changed your mind at all about when you may reopen the casinos here in Rhode Island because we may have more interstate travel with the casinos?
Yeah, I'm going to talk about casinos tomorrow, so I'll give you a date tomorrow. It's either going to be the 8th or the 15th. And say again?
That's why we like being in the room. 'Cause we can.
Of June?
Yeah, of June, sorry, of June. Early June. It's going to be early June. And the answer as between the two is there's some operational things to get done. Like, can they be ready safely for the 8th? Or do they need a few more days in order to get themselves really operationally ready? Like, as you can imagine, disinfectant, hand sanitizer, testing, social distancing, getting cash back into the building. Like, so if they can be ready safely, if they satisfy us that they can be ready for the 8th, we'll go for it. If not, we'll give them till the 15th. I will say this. Governor Lamont was fully opposed to them opening on June 1st, fully, publicly opposed. They are tribal casinos, so they are sovereign nations, and the governor doesn't have the authority to set the date. Obviously, ours is different, right? We don't have that. The folks at Twin River have been awesome partners. We have been in constant contact with them, and to their credit, they're the ones that said, yeah, we shouldn't do June 1st because we need a little more time to be ready. Wait, he's not done.
So for the people that may travel to Foxwoods and go to a casino that June 1st, would you advise those people to self-quarantine for any period of time?
Not after Monday, because we'll be in Phase 2.
Thank you, Governor.
She had her hand up. Go
I had
ahead.
a question for the doctor.
Oh, go for it.
So when you look at in Rhode Island, the number of flu cases each year, the regular flu, the average number, I know it changes year to year. What's that number compared to the current number of COVID cases? And secondly, we already have a vaccine for the flu. We have unfortunate deaths from the flu every year. So when we eventually get a vaccine for the COVID, I'm assuming we're going to have deaths. So is that maybe more of a push to open an economy? Because when we get a vaccine anyway, which we all want, we might have some deaths anyway. So looking at that, and I'm just comparing the other numbers.
So, well, just to answer your question more globally, so the COVID-19 is a more serious illness from the flu. We're seeing much more morbidity and much more mortality. I don't know the exact numbers comparing it, but we're on pace to have much more number COVID-19 deaths than flu. Just as a scope, we don't have 22 deaths on a day from the flu in Rhode Island. And, as far as about a vaccine, I'm humble for a lot of reasons in medicine because I'm in a profession that chooses to humble me every day. I don't know that we're going to have a vaccine. I want a vaccine. I hope there's going to be a vaccine, but I'm not willing to get ahead of ourselves. And I think we just have to let the science be the science and let the process be the process. The vaccine development is going through the FDA like any other vaccine would, phase 1, 2, and 3. And that needs to happen, and it will happen. And if we get a vaccine, I look forward to the day when we can talk about, one, who's going to get it, two, how we change our lives because of it. But I don't want to get too far ahead of ourselves, my friend. We'll get there, and I hope it'll be okay.